Time now for your questions. Every night on The National, we're devoting time to getting answers from the experts. Obviously, it's still light outside. We recorded this a little earlier this evening. So with me tonight, Dr. Isaac Bogosh, infectious disease specialist at University Health Network, Dr. Janine McCready, an infectious disease physician at Michael Garron Hospital, both in Toronto. So we have tons of great questions. Let's just dive right in here. So the first one is one we get just about every day. Can COVID-19 be transmitted through the handling of mail or a newspaper? Dr. McCready, can we start with you?
Sure. So far, there's no evidence that we've seen that COVID-19 can be transmitted on newspaper or paper, but we don't have all the answers yet. And there was a study from a few days ago saying that potentially the virus can live on cardboard. So what I would suggest is every day we learn more about this virus is that anytime something new that's touched by multiple other people comes into your home, wash your hands. So after you've taken a look at something, touched it, make sure you wash your hands thoroughly, and that's going to make sure that you're protected and that your family's protected.
All right, next one for Dr. Bogosh. Should I change my clothes when I get home from work, and should I wash them?
That's a tough one. A lot of it really depends on, what you do, what you come into contact with throughout the day, and also sort of personal risk thresholds and perceptions towards risk. Dr. McCready and I work in hospitals. So when I come home from work, I will be changing my clothes and laundering my clothes. I appreciate other people might not be in contact with lots of people or other high contact surfaces throughout the day, and they might choose not to do so. I think if there's any question as to whether or not you were in touch with some high contact or high risk surfaces, it's just an easy thing to do.
All right, Dr. McCready, we have a question from someone who has clearly picked up on the basics here. So since the virus travels via droplets and is not airborne, how can you get the virus from someone who is close but hasn't sneezed, hasn't coughed, or even touched you?
So that's a great question, and so a very important one. And oftentimes in our social interactions, even if you're just close to someone, you might inadvertently touch them, or more importantly, touch something that they are going to touch. So for example, if you're chatting with a friend, you might have your cell phone. If you've touched, your nose or your mouth and then touch your cell phone, you might then show them a picture, pass them your phone, and then they'll touch that. And if there is COVID-19 on that phone, then they could touch that, and then afterwards touch their mouth or nose and transmit it to themselves. So those things happen, multiple times in every social interaction, and that's one thing that can happen. And so the closer we are to people, the more likely the virus is going to use those opportunities to get from one person to another and continue to spread.
And so, Dr. Bogosh, can you jump in there?
Yeah, absolutely. I mean, as disgusting as it might sound, even though if someone's not coughing or sneezing, we're still unintentionally spitting and getting little bits of saliva out of our mouths and into the world around us, whether we think we are or not. And certainly that can fall onto surfaces, and people can touch those surfaces and then touch their eyes, nose, or mouth, and then inadvertently infect themselves. So even if someone is infected and has minimal symptoms, they're still able to transmit this infection to close contacts as well.
Next, can I look after my daughter's dog without worrying about, infection from the dog or infecting someone in my family?
I think we've got to be careful about this. We're not shaking each other's hands. We're not going around giving each other high fives. I remember when the NBA stopped doing that before the NBA was canceled. And, the more hands that touch a dog, the more opportunities there are to transmit infections. Now, of course, dogs and cats and pets need love. They need to be pet. They need to be cuddled. But, it's probably best for as few people to do that as possible, just because we could likely transmit the infection. It could get on the fur of the animal, and then it could be transmitted to another person that way.
Okay, last question, everyone. Is there anything the public can do to help make sure that health workers have the proper protection that they need? Dr. McCready?
If people have personal protective equipment that is new or unused, then a lot of places and hospitals would love to have it.
All right, Dr. Bogosh, Dr. McCready, thanks both of you very much.
Thank you.
Thank you.
As we've mentioned, we'll be asking your questions about COVID-19 every night going forward. So send us the questions you have. We know you have a lot of them. You can message us directly on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca.